Hello guys, and welcome once again to my YouTube channel. I just want to say a big thank you to all of you who have been consistently watching my videos, leaving comments. Some of you have contacted me, via phone call, WhatsApp, Facebook, and I'm quite happy with the reviews I've been getting from you guys. I just want to say I started this channel sometime in January, thereabout January, and I think YouTube sent me a message saying I've hit more than 50 subscribers already. So I'm really grateful and I'm really happy about it. On today's episode, I would want us to talk about a topic which I feel is somewhat shied away from because of the kind of stigma that is attached to it. Okay, so it's a big topic in women's health, but I want to talk about it. I want to address this topic today, and this topic is on periods. So if you're a man and you're listening in, please listen in because there's a lot of information you can get from this discussion, and you can pass it on to your wife, to your sisters, to your female friends, and your cousins, female relatives, and it could just be a game changer for them. So, what are periods? So, basically, a period is just the process of the inner lining of the womb shedding every single month. What that means is that the body every month of the woman is always getting ready to have a baby. And when that doesn't happen, the lining of the womb sheds off and that comes out as periods. Now, periods would normally flow for about, some people flow for about 3 to 7 days, okay? Would normally do that. And usually, generally, people or women have heavy flow on day two, but by day three, day four, it starts to taper down and then the period sort of stops. Now, there are some women, however, who suffer from really, really, really heavy periods, and that's what I want to talk about. For me, the first time I had my period was, I think I was 10 years old. So what that means is that I've been getting periods for over 20 years now. It's very challenging. It's not easy. I would say I have normal periods, normal flow, but I've met women in my practice as a doctor, even when I wasn't even a doctor. I had friends who were having challenges with really heavy periods. And that's what this video is about. It's about teaching women how to cope with their periods, especially those who have really heavy flow. So the first thing is this. If you're a woman and you have really, really heavy periods, I think it's something that you need to see your doctor for. And I'm going to give you reasons. Number one reason is that there are things that can cause heavy periods. One of them is very common in Black women because when I worked as a doctor, we had so many women come in and, we diagnosed them with this. And number one is fibroids. So women who have uterine fibroids, what that means is just that there's an abnormal growth in the womb. Okay, so the more the fibroid keeps growing, you find out that women who have fibroids start having really heavy periods. So normally what you see is, oh, at some point in time I had normal flow, and then at some point in time in my life I'm seeing that my periods are getting heavy. So there could be a problem, and you need to see your doctor. Your doctor will examine you, and your doctor will um, request for some tests like an ultrasound scan. So sometimes even from placing, touching your tummy, like examining your tummy, you could actually feel the fibroid in there, and that would actually help us even further send you for an ultrasound scan that would confirm the diagnosis. And the treatment for the fibroids obviously is taking them out if they are now symptomatic. As if they are causing you problems, then you need to take it out. Some other things can actually cause heavy periods. Okay, so sometimes if you're on some sort of hormonal contraceptives, some of them could actually cause you to have heavy periods, heavy flow, and all that. Some of them, when you start on the hormonal contraceptives, you initially have heavy periods and then it just sort of tapers it down. Number three, the other thing that can actually cause heavy periods is there are things like endometriosis. So that's a condition that affects the lining of the womb. So sometimes you're having really heavy periods and your periods are so painful. Things like that, you would need to see a doctor. Number four thing I want to talk about is that if you're having heavy periods and you're beginning to feel really tired and really dizzy, it is a sign that you're bleeding too much and it's beginning to affect your blood level. So you need to see a doctor. What I'm saying is that if you notice that your periods are heavy, heavier than usual, it might just be a sign to see a doctor. Okay. you need to see a doctor, because then we need to find out why you're having this problem. Some women don't even know that they had a miscarriage, and it might just turn out the only indication might just be that, oh, at some point they didn't get their periods for about 6 weeks, and then all of a sudden they're having heavy bleeding. Okay, so it might be a sign that, oh, you got pregnant, you didn't know you were pregnant, and you actually miscarried. Okay, so I'll talk about some of the ways doctors could manage these heavy periods for you. That's if you go to see your doctor. And that's what this video is about. I'm trying to encourage you to go and see your doctor if you notice a change in your periods. That if your periods are normal and they're now heavy, you need to go and see your doctor. Now, these are some of the things we do. Number one, we will obviously take a history from you. That's, talk to you about, have a conversation as to what's been going on, what your menstrual cycle has been like before, how has it changed, how has this change affected you, and how is this heavy period affecting you right now. Then we will ask for other symptoms, just to try and think of what the problem may really be. Now, the second thing would be to examine you. So the examinations will be either, most times it will be either abdominal, like the general examination of you, check your eyes, see if you're pale or not, examine your tummy, touch to see. Like I said, sometimes if you've got fibroids and the doctor examines your tummy, might feel the fibroid even moving in your womb. The other kind of examination that might be done could be like an intimate examination. So what that means is that the doctor takes an instrument called a speculum, which helps to open up your vagina, and then we look inside to see, because you could actually be bleeding from your cervix, which is the neck of your womb. Okay, you're bleeding from your cervix, which is the neck of your womb. There could be a growth inside there, or sometimes you don't even know what you're going to find. So when we do these examinations, then we come to a conclusion as to how to help you. There's some medication that you can actually take that could actually taper off. I won't say taper off, but sort of reduce the blood loss. Okay, so there's a medication that you can be given that will reduce the blood loss for you. So that medication, you only take it, a few days to when your period comes. So just a few days that you take that. So it helps sort of reduce the blood flow. Another way that it can be managed would be placing you on some sort of contraception. The most popular one is the intrauterine device. So it's more like a coil, a hormonal coil. It sort of helps to reduce that heavy flow. So women who are known to have heavy, really heavy periods, like very heavy periods, I've seen it being used, and I've also, like prescribed it myself, and advised that they should use it, and it does help control periods over time. So these are like some of the things that you could do that would help you. If at the end of the day you find out that it's a fibroid, and they check your blood level, see that this you having this fibroid is beginning to give you symptoms, symptoms of low blood level, dizziness, tiredness, headaches, you're even having fainting attacks, then it may be beneficial for you to get that fibroid removed surgically. Okay. People say, what if you give me something that is going to shrink my fibroid, that is going to, some women come with fibroids that are as big as a baby. So, and sometimes it is so big like that, it compresses on, other organs in your body. And in that situation, I think the best thing to do is to remove that fibroid, from your womb. So these are some of the things I would like to share with you guys. If you have any questions concerning heavy menstrual bleeding, or some sort of abnormal bleeding that you're having, please can you drop them in the comment section of this video, and I'll address them like more videos to come. So I'll try as much as possible to address your concerns in a series of videos, just so the videos are not long, monotonous, and boring. I hope that I've been able to pass some basic information about this to you in this video. I'd want you to click like, I want you to share, I want you to keep subscribing. Okay, so let's grow this community. Let's grow this community. If you're benefiting from the information that is being passed in this, in the videos that I'm making, it would be good to also spread the information to other people. So make sure you share this video, tell people to subscribe to my channel, and I'll see you next time. Thank you, and bye for now.